Good morning, everybody. We can still see a few people joining, so we're just going to give it a few more seconds before we kick off today. But thanks for your patience and thanks for coming today. Okay, I think we'll make a start. Good morning and good afternoon to everybody, depending on where you're joining us from today. We'd like to welcome you to our webinar entitled Empowering Road Transport Operators, Freight and Passenger to Respond to the COVID-19 Pandemic. The webinar is being hosted by Transaid and Safeway Rightway. My name is Sam Clark. I'm the head of programs at Transaid, and the speakers today will be myself, Peter Tibigambwa, the executive director of Safeway Rightway, and Jason Finch, project manager at Transaid. Next slide, please. Just before we start, I'm just going to tell you a little bit about today's schedule. The presentation part of the webinar should last about 30 minutes so that we can have ample time for your questions afterwards. Unfortunately, there isn't the facility here to ask questions verbally, but you can type questions or comments at any time during the webinar. And if you can see this slide, that should be sort of a version of what you're seeing yourself. So over to the right, there should be a questions icon. If you open that up, type in your question. It's important that you click send, don't press return, just click send at the bottom of that box. That will go to our mediator, and those questions will come through to us to answer at the end. Obviously, we'll do our best to try to respond to as many questions as possible. But for those we don't get to, there'll also be a slide at the end of the presentation with our email contacts on, and we can continue to respond via email to any questions that do come up during or after the webinar. Next slide, please. As I've already said, my name is Sam Clark, head of programs at Transaid. We're going to tell you a bit about what we're seeing on the ground today in relation to truck drivers in Uganda in a COVID-19 context, and how we're integrating a response into our current program activities. So first, I'm going to tell you a little bit about our current program. Next slide, please. In 2015, Transaid develops the EAC standardized curriculum for drivers of large commercial vehicles, passenger and freight. And this work was commissioned by the EAC Secretariat and funded by Trademark East Africa, with the intention that all EAC member states adopt this curriculum as a regional standard. Uganda used the oil discovery in the west of the country as a catalyst to upskill their drivers to support the oil and gas sector and to prepare for the adoption of the EAC curriculum. And since 2016, Transaid and Safeway Rightway have been working together on the Professional Driver Training Uganda project, together with GIZ, under the Employment and Skills for Development in Africa initiative to achieve this. Our aim is to build the capacity of Ugandan trainers to deliver training to the EAC standard so that more Ugandans can benefit from the anticipated increase in demand for drivers in the oil and gas sector. Next slide, please. Just over 3 years have passed since we began, and the team have a lot to be proud of. Where there were no trainers able to teach the EAC standards back in 2016, we now have 16 trainers who, in our opinion, are amongst the best trainers delivering HGV and PSV training in the region. Not only that, to make sure that the capacity remains in country by the end of the year, we'll have 3 Ugandan master trainers who'll be able to train more trainers as and when the demand requires it, which is a really important resource for Uganda as well as the EAC region as a whole. In analysing the future demand for drivers and the sector's ability to train sufficient drivers to meet this demand, we quickly came to the conclusion that there was a need for additional institutional capacity. So, as well as supporting existing driving schools to upskill, we've also set up a new specialist training centre just outside Kampala, which started training drivers back in 2018. This is now one of the best equipped HGV and PSV training centres in the region, with 4 resident trainers and 5 vehicles for truck and bus. This centre will be run by Safeway Right Way. It is being run by Safeway Right Way, and it will, in the longer term, be run as a social enterprise, with the surplus that it generates being invested back into wider road safety projects, which we consider to be quite a unique model as far as training centres go. So far, the centre has trained more than 170 drivers for new licence acquisition, that is, in line with the EAC standards, and as well as that, we retain the commitment to support trainees into work once they've completed the training successfully. And finally, we're happy to say that we've achieved an early partial adoption of the EAC curriculum as a standard for drivers working in the oil and gas sector. So we're still awaiting for the full adoption to be implemented by the EAC, but we're really happy that the Petroleum Authority of Uganda and many of the large transporters in Uganda also have confidence in the fact that the training materials we're using and the skills requirements needed satisfy basically the future demand for drivers from their side. While we've been unable to, next slide please. While we've been unable to provide face-to-face training at the training centre since March due to the COVID-19 pandemic, we've been using this time to review and amend our current training materials based on the lessons we've learned over the last few years. The trainers are continuing to develop their skills independently, and we're also continuing to engage with transporters so that we're able to support their training needs as and when it's safe to do so. We've also naturally been keeping an eye on developments on the ground and the challenges facing truck drivers as they continue to keep supply chains functioning during these challenging times. Peter's going to tell you in a bit more detail about what we've been seeing in recent weeks, with a particular focus on Uganda. But before he does that, it's important to say that many of the issues he's going to highlight are not limited to Uganda at all. We're seeing very similar situations throughout the region and beyond, miles and miles of tailbacks at border crossings, truck drivers being thrown into environments which make it nearly impossible for them to distance themselves from each other, and also to properly protect themselves from exposure to the virus. I'd like to now introduce you to Peter Tibigambwa from Safeway Right Way. He's going to provide more detail about some of the challenges that truck drivers are currently facing on the ground. Thank you.
Thank you, Sam. Thank you for the background of the work that we've been doing together in Uganda. I'm Peter Tibigambwa, and I work with Safeway Right Way in Uganda as the executive officer. I'll tell you a bit about Safeway Right Way to start off with. Share a bit about what the Ugandan freight transport looks like, what level of COVID exposure we've had specifically for the truck drivers in Uganda, the challenges or the key challenges that the truck drivers are facing so far, and the recent developments, as we then will listen to Jason about tell us about the plans that we have to come in and support the truck drivers. Next slide, please. Next slide, please. Safeway Right Way is a charity organization or a non-government organization born out of the need to promote road safety in Uganda. And we believe that road crashes or and road accidents can be eliminated by changing the behavior of road users, with lobbying and advocating for adequate laws and improved road infrastructure standards within Uganda. And we believe the same recommendations apply across board in any other country. We were established 7 years ago and founded by the World Bank, coming together with private sector organizations, mainly the Total Foundation, and have gone on to be supported by other companies in the oil and gas sector, in Italo Oil, among other institutions, of whom some are here with us today. Our work has stretched from legislative action with parliamentarians by establishing the Parliamentary Forum for Road Safety, and also direct implementation in partnership with the main arms of government in road safety. Beyond the establishment of the Parliamentary Forum for Road Safety, we've conducted speeding campaigns or championed speeding campaigns, developed material for road safety awareness, and worked in schools that are most at risk on road corridors in Uganda, and also worked directly with the Ministry of Works and Traffic Police in Uganda to advocate for reduced speeding and feeding into reduced road crashes. As Sam mentioned earlier, we've also recognized that there was a lack of standardized professional driver training, specifically for HGV and PSV drivers, and then went on to adopt the ESC curriculum, and are proud to have seen that the Petroleum Authority of Uganda and larger institutions in the transport and logistics sector have gone on to adopt this standardized training. Next slide, please. When it comes to the freight transport in Uganda, research shows that just under 32,000 distant truck drivers will be in Uganda at any given time, with the eastern parts or the eastern border side, mainly Malaba and Busia, having just about 1,800 trucks crossing every day or within 24 hours, and about an estimated 400-600 trucks crossing on the other border posts in Uganda. The just under 32,000 long distance truck drivers include inland truck drivers as well as cross-border drivers. As we may be aware, for those of us who have been keeping track of the coronavirus in Uganda, over the last 4 to 6 weeks, we've seen that the truckers or truck drivers identified as the main risk for COVID-19 infection in Uganda. It's not the first time this has happened. Different research again shows that long distance truck drivers and other transport workers are usually at higher risk of acquiring and spreading any infectious diseases. So as we look into the challenges, we'll see that some of them build on from the challenges that historically truck drivers have continued to face. Next slide, please. When it comes to exposure, on the slide coming up, you'll see to the right-hand side, the day that Uganda witnessed the highest COVID-19 cases was 30th May, with 84 cases. And again, 52 of those cases were truck drivers. 50 had arrived from Southern Sudan, with 32 who were cases of contacts of previously confirmed cases. We've seen that the government has stepped up to have the tests for COVID-19 received as soon as possible, mainly for truck drivers. And most recently, we saw that as of yesterday, just over 96,000 tests had been confirmed. The number of positive cases in Uganda, again, as of numbers from yesterday, are 489. And from the presidential update on 1st June, we saw that 332 truck drivers had been reported to have tested positive. Again, 368 truck drivers have been turned away at different border posts. And the number of truck drivers who have tested positive and the Ugandan were reported to be 277. Current trends or undocumented reports indicate that most of the Ugandan drivers who are testing positive are actually dominantly inland drivers rather than cross-border drivers, and mostly drivers who are on short-term contracts as compared to drivers who are working in a more systematic or the larger transport and logistic corporations. Again, looking at the national statistics, about 80, the reported number is that 82 have recovered. And again, from the presidential update, we learned that 15 out of the truck drivers who had tested positive had recovered as well. No deaths have been reported in Uganda as yet, as we continue to follow the statistics from the Ministry of Health. With these numbers and with the number of truck drivers that have been turned away, we've continued to see reports of, especially from 14 days to 10 days ago, border strikes, which exposed drivers to increased infection. And with the strikes mainly coming up because of the measures that had been adopted at the borders. But since we've seen the situation improve, although we must recognize that it was a challenging time for the drivers, considering that some of the it was reported that there was about 60 kilometers blockades or waiting distances for the trucks to be cleared, mainly on the Malaba and Busia borders. Next slide, please. This background of the number of truck drivers that have tested positive, with the measures that have been put in place at the border, at the different borders, have presented great challenges for the truck drivers. These are what we are going to look at now. It's very clear that with the communication about how much the truck drivers have exposed the Ugandan population, we've seen public negative responses to the truck drivers, and sadly some politicians also coming out to call on the government to marginalize truck drivers, as they have been referred to as the importers in some cases, or the causes of the current COVID-19 infections and the measures that the government is taking. The ban on the use of hotels and guest houses by the government as well, whereas it has been necessary, this has caused the challenges to the truck drivers. We recognize that the government has tried to also provide resting places for the truck drivers. However, the demand for the desired mainly water, sanitation and hygiene facilities in these areas has been rather high, and the drivers continue to suffer in different areas because they cannot access resting areas. We've also seen that there has been a negative impact on the ability to rest on trips, with some drivers reporting to plan for straight-through driving, which exposes drivers to between 1,000 and up to 4,000 kilometer routes, where they decide to try and do a straight-through rather than stop at the facilities that have been provided by the government. We continue to see cases of truck drivers being turned away as well from the now public places, even when the now open public places, even when they have tested negative and pose no risk of infection to the public. This again is attributed to how much knowledge the public has in relation to who has tested positive or who has tested negative, and how much risk is presented by the truck drivers, especially even for those who have tested negative. We've seen cases of reported cases of relay driving, mainly in Rwanda, and discussions have also been ongoing in Uganda to see whether this is a model that can be adopted. Should this model be adopted, there's a threat to especially small and medium enterprise operators in the transport and logistics sector who cannot afford or who do not have human resource capacity in Uganda and the neighboring countries. Again, the truck driver, no specific guidance or awareness and sensitization material has been developed that is targeting truck drivers or targeting the public on how they can respond to the danger or the potential risk from truck drivers. But we must recognize that some information has come out and some videos have been sent out by the ministry. However, very limited documentation has been shared. Next slide, please. As I conclude on the challenges, we've also recognized that there's limited appreciation of truck drivers as essential workers during this time, and yet they are the heroes that are keeping the nation moving, especially for goods and services, for goods that we do not have in country. With these challenges posed to the truck drivers and to the government in responding to COVID-19, we've witnessed in recent times following developments. With the trends of truck drivers testing positive, we've seen the Ministry of Health and the government pass resolutions to test all truck drivers coming into Uganda. As I mentioned earlier, recent anecdotal reports show that the Ugandan truckers who have tested positive are mostly inland drivers. We've also seen that the government has made a commitment to return test results as soon as possible, and again, recognizing the growth in cases, especially in the eastern and northern borders, the government has moved to install testing centers at the border posts, with the Ministry of Health this week committing to install a testing center at the Legu border post, again recognizing the number of positive cases that have been identified at Legu, but also the fact that initially Legu could only clear up just over 200 trucks in a day, and with the delays of those who are being tested and the results coming back, it was important that such facilities are provided closer to the border. As I mentioned earlier, we've seen that drivers are being turned back in large numbers, with over 300 who have been turned back. This has left a level of anxiety within the drivers, and also in some cases where we've seen contradictions in test results, with a case about 10 days ago between the Kenyan test results and test results from Tanzania of truck drivers. We've seen longer waiting times for clearance at borders, affecting transport and logistics sector, especially when it comes to perishable goods. This has again called for innovation for those who are within the sector, but also posed a challenge for drivers who have been left stranded at these quarantine zones or isolation zones, especially with no public transport in these areas at the moment. We've again seen greater initiative by the Ministry of Health and the government in general, with officials from different institutions visiting the border post, and indeed seeing is believing. So as a result of this, that we've seen that decisions have been made to have testing centers closer to the border posts, and greater movement towards addressing the public on the cases that are coming up from truck drivers. As we move forward, we are looking at how we can address the challenges that have been faced, how we can support the truck drivers, and how we can work with the Ministry of Health and the other line ministries in sensitizing the truck drivers on issues of COVID-19, those in the freight transport industry. I'll hand over to Jason to take us through the plans that we have. Thank you.
Thank you, Peter, for that update, and thank you, Sam, for starting us off. My name is Jason Finch, and I'm project manager with Transaid, and I'll be speaking a little bit to how Transaid and Safeway approach these challenges that Peter just discussed, and what early actions we're planning on taking to empower road transport operators in Uganda. Could I have the first slide, please? Okay, as Sam said at the beginning, with our professional driver training program, we've been in Uganda since 2016. And when the coronavirus outbreak was declared a pandemic, that program was ongoing. And we, like others, decided to wind down activities, take shelter, and take stock of the situation. But being there in the beginning and since being in regular communication with our partners also meant that we were able to observe and to some extent monitor the impact the pandemic was having on transport systems and their operators, both in Uganda and the wider region. And we, like possibly most in this call, were not entirely sure what it was that we were watching unfold and what it was that we were waiting for. And I know my colleague Kim will attest to this, that we followed and researched a number of those early developments for quite some time. What was not necessarily unique but interesting all the same was that as the widespread lockdowns and curfews were imposed and the travel restrictions went into force and the shutdown of public transportation essentially brought intercity travel to a standstill, freight and cargoes continued to flow through the EAC. And this was a particular challenge for Uganda, which is surrounded by 5 huge continental neighbours, and some of them completely landlocked and thus dependent on Uganda for the passage of its freight. Before the pandemic, it was estimated that 7 out of every 10 containers landing in Mombasa was in itself destined for ITDs in Uganda. And those early widespread distributions of in-kind donations that we were seeing in late March and early April soon became much more organised and structured. And it was something that we could follow. And it seems a bit crude now, but early on we were genuinely sticking post-it notes on paper maps. Every time the Ministry of Health visited a border crossing or a junction town, whenever the inland clinics along the major corridor routes were being replenished, and wherever the INGOs were beginning to host activities at the border crossings, including vehicle spraying and the installation of hand washing stations. And what we were seeing was a reflection that for the first time, the northern and central corridors, which link a number of countries to valuable import and export markets via Mombasa and Dar ports, were being talked about as major transmission vectors for the virus. And that truck drivers tasked with maintaining these vital supply chains were quickly becoming unwilling protagonists in its spread. Have the next slide, please. Okay, so we know how we got here, but what actually changed? Well, around this time, the closure of businesses and schools and other venues, restaurants, bars, places of worship, etc., were becoming widespread. Lockdowns, curfews, and even obligatory confinement periods had become norm. But Uganda was also among the first to introduce changes specifically targeted at truck drivers. For example, in addition to the closure of many roadside vendors, truck drivers were specifically barred from interacting with local businesses. And Peter mentioned this previously, but what this meant was that they were no longer able to take accommodation in roadside lodges and hotels. Around the same time, many of the rest stops and lorry parks that were familiar to truck drivers and part of their routines were also closed, moved, or redesignated. Suddenly, planning a route with adequate rest became a challenge. And so the cumulative effect of these changes felt, both direct and indirect, we believe brought about many new risk factors for both truck drivers and road users. And in these times, we are trying to strike a balance between being overly cautious and speculative and then hesitating too long. And in as much as we're tracking those changes and listening to our partners and talking with drivers, we are, of course, in these early days, taking the anecdotal and extrapolating it into the unknown. For example, do less vehicles on the roads encourage more risky behaviors? And with the suspension of public transport, are more pedestrians and cyclists interacting with the roads? With road safety being a core component of our work, we have chosen not to hesitate. And it's important that we acknowledge this early on. We are making leaps, but we are sense checking our values all the time, within the team, on the ground, and now more widely in seminars like this. Can I have the next slide, please? Brilliant. Several times now I've made reference to our partners in Uganda, and since early on we've been in discussion with the transport unions and associations. The UPDN and the ATGWU have just been fantastic in guiding us and steering us through this concept and into proposal. And not only were those discussions a vital part of our sense checking, but they also helped us identify so many assumptions that we were making. For example, we had to start over. Coronavirus was still poorly understood in the truck driver community, and what we were hearing was a mix of everything ranging from confusion to conspiracy. And it's possible that due to the nature of truck drivers' work, them being on the roads for sometimes weeks at a time, that they were largely missing out on the coronavirus sensitization messaging, which was, particularly in the beginning, largely being targeted at the urban populations. And so we agreed we needed a strategy to reach out to drivers through the networks that they knew and trusted and deliver a message that was tailored to them and their work. And in that messaging, we needed to introduce the activities and the materials that would help them keep safe and provide the means and equipment to follow those national guidelines. And by enabling drivers in this way, they can be seen to be adhering to the rules, which we believe plays its part in countering some of that negative attention currently following truck drivers around and some of the hostility that Peter has previously spoken about. Have the next slide, please. Through channels that we'd previously opened, we approached the Ugandan Ministry of Health and spoke to them about producing driver-specific sensitization materials, again, in line with the current national guidelines, but tailored towards the needs of drivers. And the response was really positive. And since then, we've actually taken the lead on developing the materials in-house, allowing us to design the layout and the content from the bottom up. And this was a really fantastic opportunity for us because we're able to talk about some of those occupational hazards and the deteriorating work conditions and align them with the language of the ministry and its national response. And this has not only brought a huge amount of credibility to both the materials, but has also put more attention to the plight of truck drivers at the very highest levels. We have 2 pieces in the works, and their drafts are on the screen at the moment, an information poster and a truck cleaning guide. And the latter was actually heavily influenced by the materials developed by some of our corporate members who themselves had to rapidly design and circulate their own materials. And I thank those for responding to our emails very quickly. Both prints are actually stickers, and we hope that they will be stuck and therefore retained. We expect to hear final approval on the materials so we can use them this week. But just to let everybody know, we will be uploading these to our Knowledge Centre in at least 4 languages we have planned so far. So they'll be available to download and distribute for free. Can I have the next slide, please? So what is our strategy? What's our plan? Well, this first and initial response can be loosely grouped into 3 components, all happening simultaneously. We would produce the necessary sensitization materials that were missing from the community and take this opportunity to reaffirm key road safety messaging. We would procure the materials and introduce the means to implement those guidelines, face masks, which are now mandatory in Uganda, hygiene soap for hand washing, and a water can or jerry can to help deal with the uncertainty of finding potable water along the route. Our partners, the UPDN and the ATGWU, are now busy recruiting members from their networks to visit these lorry parks and the border crossings and hand these packages over to drivers with brief instructions and face-to-face sensitization, which we hope will add further value and purpose to the items. And as part of this meet and greet, we'll also be collecting phone numbers and asking drivers to subscribe to a WhatsApp channel, where we'll be distributing video demonstrations to reinforce some of the information in the printed materials, but also send vital text updates and useful information as they become available. Next slide, please. We've been really fortunate in that we're uniquely placed, well connected, and we believe as best informed as we can be during a pandemic. And we've been able to move very quickly on this. And it's with the fantastic cooperation of GIZ, and not to mention the flexibility of Safeway Right Way, that we've been able to integrate this initial COVID-19 response into the current programming. Our deliverables or the numbers, they're ambitious, but we feel confident that they're achievable. And a big part of this program's design was actually its scalability. And essentially, with more funding, more units can be purchased and more drivers can be reached. And we are currently actively seeking opportunities to scale this project further into Uganda and also into other countries regionally. Also, these activities put us, by extension, back into the field and back onto the front line. This is a rapidly changing situation, and we are keen to get as much reliable and first-hand information as possible, which we look forward to sharing with you all at a future date. And that concludes my scripted presentation. I'm going to hand back to Sam now for the questions and answers.
Thank you very much, Jason. Right, we have a number of questions coming in. One of the questions actually I'm going to jump to straight away. There was someone asking questions via audio at the end. Unfortunately, we don't have that facility on this webinar, but if you look to the right of your screen, you should see a panel. There should be a question box in there which you can type your question to, or there are our email addresses on the screen now, and we'll gratefully receive any questions via email, which we'll try and answer. Anything we can't do today, we'll obviously get back to you. First question is actually, it's more of a comment. It's from the Transport Research Laboratory, our friends there, just asking about the content of the EAC curriculum. Sort of quite keen to keep the focus on COVID-19 today, but I would gladly share the content of that curriculum with you. No doubt there are some shortcomings in terms of the things that you mentioned in terms of emissions, reducing emissions, and survival strategies for drivers in the field. But we have integrated modules on disease transmission, which I think we'll probably have to revisit in the context of COVID-19. And we've also integrated training to look at truck drivers as in a role as a sort of possible first responders in the event of road crashes. So we shall be in touch there, and we'll shall gratefully share the content of that curriculum with you. Jason, I've got a question for you here. Are other national and international organisations supporting truck drivers at the moment with, for example, food, water, access to sanitisation facilities?
Thank you, Sam. Actually, a number of those activities that we were witnessing happening from pretty much the end of March onwards are still ongoing. Certainly, there was a rallying cry to introduce hand sanitation stations, sanitizers, truck spraying, all kinds of these activities that really pointed us towards watching lorry drivers as a sector, really. I'm unsure at the moment whether or not that extends to sustenance and food and water. But certainly what we're seeing on the borders now as the tailbacks of drivers become even longer and longer, now 30, 40 kilometers and at some places, that we are going to have more specific needs. And certainly there's probably going to be a call for intervention in those places. It's something we're keeping an eye on. And certainly if there's any way that we could network with those activities, I think that would be beneficial to both parties. Definitely something to keep an eye on. Thank you.
Just to add to that, our friends at North Star Alliance, who have the blue box clinics at many of the border crossings in East Africa and beyond, are responding as far as we know, and I think their response was really rapid. So they are definitely worth looking up. But actually, we've seen most of the response actually from the unions and the associations themselves, which is really why we've decided to team up with them. They're the guys with the resources on the ground, people in place, and you know, this situation demands a rapid response, and we really considered that to be the best way of working through the likes of the UPDN and the AGTWU in Uganda. Next question, Peter, this is specifically requested for yourself. What, according to you, may be the cause of infection amongst drivers?
Thanks, Sam, and thanks for the question. As I mentioned in the presentation, the truck drivers are mostly are seen to be most exposed to infectious diseases because of the nature of their work. You'll find that a truck driver is almost in 5 different locations within a space of about 24 hours, and is interacting with different people from different communities. And I think beyond that, when it comes to COVID-19, by the nature of the work of truck drivers in Uganda and going in and outside the country, has exposed them a lot more to different environments, and hence greater exposure to infection as compared to any other person in any other business industry. And I think beyond that, we've also got to be mindful of the factors. The truck drivers we are talking about are those who are carrying goods that were from outside of the region per se, and to a certain extent, considering that a lot of imports that come into Uganda are coming from countries that were highly affected by the virus. So their risk of exposure is much higher in the COVID-19 context as compared to the other population. And usually on a day-to-day basis, truck drivers are also exposed greater to infectious diseases by the nature of their work and the nature and the fact that they interact with a lot more communities as compared to other people within the country.
Thank you, Peter. Thank you. Question for, actually, I'll take this question. So there's a question about the recent stigmatization of truck drivers, echoing the situation in the early days of HIV/AIDS. Are there any lessons learned from the management of that particular crisis in the trucking industry that can be applied to COVID? I think the basic, in answer to that, I think the basic principles are similar in terms of truck drivers being a particularly at-risk group and prone to transmission or sort of lack of exposure from the virus itself. But I think the speed of spread that we're seeing in COVID is possibly like nothing else we've seen before. Admittedly, I think we've probably been, I think regionally, nationally, the different approaches to lockdown and the restrictions on people's movements has sort of slightly confused the response and in a way sort of neglected to properly protect truck drivers. And I think certainly that could be improved. I think there needs to be a more coordinated response, a more joined up response on a regional level possibly. But back in answer to your question, I think there are, as I said, the basic tenets are the same, but I think we're learning a lot more from COVID at the moment in a different sort of a way. And we'll obviously do our best to share that learning so that for future shocks we can be prepared and ready to respond more rapidly. There's a question for you, Jason. Can the materials be the materials that we produced? Can they be produced in other languages such as Swahili and Uganda? That's from Emma from Total.
Actually, thank you, Emma. The languages that we have slated to be produced are Swahili, Ugandan, English, and French. But there was recently, at the end of last week, a call for also doing it in Somali. So certainly the materials can be adapted into any language, and if we get feedback that there's a request for a certain language that we've missed, I think we'd be very happy to attend to that. And again, we'll put all of these onto our website and make them free for distribution.
Thank you, Jason. Just to tell you, we are running slightly over, but we don't really have a problem with that as long as we can try and sort of get through as many questions as possible. But as long as that's okay with you, we'll continue for a little while. Right, there is another question. The closure of truck stops and lorry parks is clearly a negative move for drivers. Are similar actions occurring in East and Southern Africa, Central Corridor, North-South Corridor, etc.? If yes, how is the truck industry responding? Peter, maybe you could correct me on this, but my understanding is that truck stops are not necessarily being closed down. It's more access to facilities linked to those truck stops and en route. So a ban on access to hotels and guest houses in Uganda obviously has implications in terms of drivers' access to washing facilities in a context where hygiene is of the utmost importance. And likewise, I guess the most difficult thing at the truck stops is the actual compliance with the national guidelines, such as those on physical distancing and so forth, and whether they're being policed to the correct extent, which I don't think they are at the moment. But that's certainly something we aim to raise awareness about as part of the initiative that we're proposing here.
Yeah, I think to add to that, our focus really is going to be on emphasizing the importance of social distancing and the rationale behind the recommendation to maintain the social distance that has been encouraged. But again, there are areas that the government has specifically said truck drivers are not allowed to stop there, and that's to ensure that the truck drivers don't divert to other areas that cannot be controlled through enforcement. So the enforcement measure there is to stop trucks from stopping there at all. There are areas that have been to know that say gazetted by the government as no stop zones for truck drivers. And this information is available on Ministry of Health website. But if you'd like to have this information, you can email it to.
Thank you. Another question, which I'll take offline at some point, but I'm going to read out. Are better trained drivers resulting in less crashes, in better maintaining trucks and less overloaded trucks? To me, we're trying to stick with the COVID-19 response at the moment, but we'd happily take that question offline, whoever asked that. We're certainly running, in parallel to the GIZ program in Uganda, a program which intends to monitor trends within within drivers that receive our training and look at them over the long term to see what the positive impacts of that training. So I would happily have a conversation offline with the person that asked that question. Here's a question for us as well. To what extent is the Northern Corridor Secretariat taking a corridor approach to mitigate truck drivers' exposure to COVID and harmonise different national approaches? I think the approach we've seen at higher level authorities is one which is seeking to minimise, or not minimise, but reduce the reliance on road transport corridors. So certainly there's a greater emphasis on rail in Kenya. I'm moving the last couple of weeks to transporting materials from Mombasa to the inland container depot in Naivasha by rail and then onwards by truck. Unfortunately, Uganda is perhaps not as infrastructurally developed, although there are a number of projects taking place at the moment within Uganda to address that. They are pretty reliant on the road transport operations, so there aren't an awful lot of other options to take in that front. I was on a webinar very recently where it talked about historically using Lake Victoria and water transport as that making it more of a proportion of total freight transported, and obviously rail as well. And then there are efforts I know in Uganda to do something about that in the near future. Right. Here's a question. Is there any way of telling if drivers have been motivated to change some of their behaviour? I'm going to ask that to Jason.
I was going to ask it to Peter. Actually, Peter, because of your more regular contacts with John Mark and associations, would you like to respond to that?
Yeah, sure. Again, it's not very clear what level of motivation has been given to the drivers. What I can say is that from my understanding is the larger corporations have taken on some measures and will be looking to work with those corporations as part of our intervention, so that we are not reinventing, but working with them to add to what's already been done. So in some areas, you'll find that the larger corporations in the transport and logistics sector have sought to motivate the drivers within their employment bracket to remain committed during this time and respond appropriately to the COVID-19 pandemic. I cannot say when it comes to the general driving industry, but yeah, from the perspective of larger corporations, that's what's been done. Our commitment is to work with these corporations on what's been done, but also targets everyone that will come to the spots that Jason shared, where we shall be positioned, see how we can best motivate them.
Thank you, Peter.
Thank you, guys. There's a comment here asking why we didn't introduce Transaid. I can definitely sort of tell you a little bit about Transaid very quickly. Transaid is a UK-based NGO. We're specialists in transport and logistics. Back in the 80s, we were sort of a linchpin between sort of bringing the private sector expertise in that field over to the aid sector, and then we gradually moved away from that. In 1998, we became an NGO which sort of focused more on long-term development, and since then, the basic principles remain the same. We're sort of very private sector facing in terms of the transport and logistics industry, and sort of harnessing that expertise and bringing it into a development context in an appropriate way, obviously. We have two core areas of work. One is access to health. This sort of area is largely based in a rural context. We look at access to healthcare and the difficulties that people have in accessing healthcare from a transport perspective, and we try to implement emergency transport solutions. We're working in a number of countries on that. We've worked in Uganda before with boda riders in 5 districts. We're currently working in Zambia, Madagascar. We've just finished working in Nigeria. That's really a core part of our work at the moment. And the other core area is road safety, with a specific focus on professional driver training. And by professional, I mean truck, bus, and increasingly motorcycle taxis and 3-wheelers as well. So we look at improving driver training provision, training of trainers, building that capacity, improving driver and rider behavior on the roads, and also developing standards for national level governments or regional level governments to adopt and enforce. And it's on Uganda with the GIZ program on that side of things that we're currently working with at the moment. But if anybody would like to get in touch with us to ask us more questions about Transaid, they'd be very welcome. One other question, how come you're only working with one driving school, Safeway Right Way? The answer to that question is we're not. The new specialist training school that we've set up in Makono, just outside Kampala, is an initiative specifically with Safeway Right Way, but a key part of the program as a whole has been about building institutional capacity to other providers. So we have been working with several providers in Uganda. As I said, we have 16 trainers trained, and 5 of those were from the Safeway Right Way Specialist Training School. So the other 11 were spread over, I think, up to about 7 or 8 different driving schools in Uganda. Another question, to what extent are we engaging with the communities along the corridors in a bid to address the current stigma being directed towards truck drivers in the wake of COVID? And I think I'm going to pass that to Jason.
Thanks, Sam. I think at the moment, particularly in the last couple of weeks, we're just trying to get a handle on what the content of that stigma and the source of that hostility is from. Certainly, by identifying truck drivers early on as a high-risk group and as carriers of the virus, that in itself brought a lot of negative attention, and often, actually, quite a few times within the press, that the recommendation was to stay away from truck drivers, not to interact with them, and also more recently with businesses being closed to them, specifically closed to them as well. As for the communities along the roadsides, we don't have a reach, we don't have a presence there per se. But we are definitely aware that if we can demonstrate the truck drivers adhering to the guidelines and actually responding to some of the health advice that is part of the national strategy, we can show their behaviours in a more positive light. Not having the means to be able to respond to the guidelines is one problem, but also, you know, the very selective distribution of that messaging is another. Something that we are becoming increasingly aware of, particularly in the last couple of weeks, is that the truck drivers that are being held now at the borders because of the mandatory testing that's going on for everybody entering the country, sorry, for all truck drivers entering the country, we're now seeing that, you know, patience is running out. The truck drivers are out of the basic necessities that they need. They're becoming frustrated. They're also they're worried and they're scared, and they're beginning to protest. And that imagery is possibly going to add to the negative associations that are currently being in circulation with about the drivers, which is part of the urgency about why it is that we were in discussions with the associations, trying to reach those drivers as quickly as possible and basically counter some of the challenges that they're facing, but also just make sure that people are aware that their situation is difficult, but they are responding the best way that they can.
That's great. Thank you very much, Jason. There are still a number of other questions unanswered, which unfortunately we don't have the time to answer online, but we will do our best to get back to you via email if we have your contact details. And like I said before, I think you have our contact details from that last slide. So please, at any time, feel free to get in touch and ask any questions you might have. Thank you very much for taking the time to join us today on our webinar. It's been interesting talking to you and listening to the questions and the concerns that you have on this particular issue, which we think is of prime importance. And as we kick off our activities at the border over the coming days, we shall be more than happy to keep you updated with our progress. Thank you very much, everybody. Bye-bye.
Thank you.
Thank you.